This hour with breaking news, the White House Coronavirus Task Force is about to hold a briefing. The president is at the podium. Let's listen in.
A lot of things going on. We're going to be going over to the Hill and having a lot of meetings. From the financial, this is a medical situation, not a financial situation. The financial, though, is moving along very nicely. I want to thank you for being here and update you on the progress we've made after a week of extraordinary mobilization in our war against the virus. Governors, mayors, the businesses, charities, and citizens are all working with urgency and speed toward one common goal, which is saving American lives. We're in communication with foreign countries. It's now at 148 foreign countries. Can you believe that? 100, you talk about a spread, you talk about a violent spread, 148 countries. Not even believable. There's been a week of national action and of great national solidarity. People are getting along. We're getting along with Republicans and Democrats and independents and liberals and conservatives, and actually it's a very nice thing to see. We're all one beautiful big American family, and that's taking place right now. Last night I approved a major disaster declaration for the state of New York. I worked very closely with Governor Cuomo, and this is the first time in our nation's history that a president's used the Stafford Act to declare a major disaster in response to a public health crisis. Never happened before. I'm considering other areas where we may or may not be doing that, and working very closely with Gavin Newsom, Governor of California, and others. We may be doing the same thing depending on their needs, depending on what they're asking for. It's been unprecedented action in New York, and we've had a tremendous federal response all over the country. And I want to thank all the people in the federal government and obviously in the state governments and local governments. We are working hard. Everybody is working hard. And the people standing alongside of me are working very hard. That I can tell you. We've also reached agreements with Canada and Mexico on new travel rules at our northern and southern borders to halt the entry of the Chinese virus while continuing trade and commerce. And we've had very good talks. With Prime Minister Trudeau, and today, this morning, with President Lopez Obrador. And we talked about joint measures that we're taking to prevent the spread of the virus in our countries and to temporarily suspend non-essential travel. We had a great conversation this morning, President of Mexico, and our close cooperation with Mexico and Canada will keep our people healthy, keep their people healthy, keep everybody safe. Yesterday, I had a call with 12,000 small businesses, representatives of these businesses. That's the engine of our country. People don't realize that. You know, you read all about the big ones, but these small businesses, when you add them up together, are really the engine, economic engine of our country. And I assured them that my administration is doing everything within its very considerable power, frankly, to support them and their employees. Nobody's ever done what we've done. Likewise, I had calls during the week with all sorts of representatives and systems like the hospital system. We spoke to many of the hospital systems throughout the country, nurses and doctors, representatives representing hundreds of thousands of nurses and doctors, airlines and cruise ship companies, the Business Roundtable, which was fully attended, and it's all of the top CEOs of our country and beyond, frankly. The businessmen of, really, these are world-styled businessmen. These are businessmen that control the biggest companies in the world. Many of them have taken hits, and many of them are just, going forward. Their businesses have been great. Some have been very badly affected. Some haven't been affected at all, and frankly, some are doing very well. They continue to do very well. It's Walmart, as an example, has been really helpful to us. Doug McMillon, head of Walmart, really helpful to us, and I guess I assume they're doing pretty well because people are certainly buying more than even a clip at Christmas by substantial numbers, pretty amazing, but they're doing incredibly. They put on tremendous extra staff. You don't have empty shelves. A lot of things have happened that are very good. Restaurants, fast food executives, grocery stores, all retailers, literally all of them, in groups. And we spoke with the G7 leaders at length, as you know. You probably know about that. Spoke to many of the governors, spoke to almost all of the governors at conference calls and many of the governors individually. And very importantly, the religious leaders. We had a great conversation yesterday, the Vice President and myself, with the religious leaders of our country, many of the religious leaders, and we've had a number of them during the course of the last 2 weeks, actually. But yesterday we had a very significant call with the religious leaders of our country. I signed legislation providing American workers with paid sick leave and paid family medical leave at no cost to employers, and free testing for those who need it. The testing is going very well, and the Admiral will speak to that along with Tony. We're working quickly to pass additional legislation that will provide massive relief to small businesses and affected industries and give direct payments to our great workers and hardworking American families. There's never been anything like we're doing on the Hill right now. They're negotiating. Mitch McConnell, Chuck Schumer, they're all up there. Kevin McCarthy and Nancy Pelosi. They're all negotiating, and everybody's working hard, and they want to get to a solution that's the right solution. I think we're getting very close. We've also announced that we've moved tax day from April 15th to July 15th, which is a big deal, giving businesses and individuals extra time to file and pay without interest or penalties. So we've moved the date way back, and so it'll be July 15th instead of your traditional April 15th. And very importantly, you will have a lot of time, but you're not going to have interest penalties or any kind of penalties by filing at that later date. HUD announced that foreclosures and evictions are suspended for single-family homeowners with FHA-insured mortgages for the next 60 days. And our great head of HUD, who's with us today, Ben Carson's going to say a few words in a moment. The Department of Education will not enforce standardized testing, which is another big deal, requirements for students in elementary through high school for the current school year. Not fair to do that. So we are waiving that. I would imagine it's probably the first time ever that's been waived, but I think it's only fair to the students and to the parents of the students. It is also waiving interest and other things that we're discussing right now on federally held student loans, and directed that borrowers be allowed to suspend their student loan payments without penalty for at least 60 days. And we'll be talking about student loans, going to help the students. They're under a great burden right now, so we will be talking about that further, but we're waiving during the 60-day period various elements and very important elements on student loans, big subject. I signed an executive order invoking the Defense Production Act, as you all know, giving us powerful new authorities to help states, cities, and hospitals procure needed supplies. There's been a clear call to action to the private sector, and the call is made right here. It's been really pretty amazing what's happened with the private sector. They are really in sixth gear, I think, which has responded in full force, helping to produce and supply much-needed masks, swabs, sanitizers, ventilators, and everything else. There's a move on that's incredible right now. And by way of example, Hanes, everybody knows Hanes, great company, great consumer cotton products company, is retrofitting its manufacturing capabilities in large sections of their plants to produce masks. And they're in that process right now. And in my direction, the FDA has taken rapid steps to make these items available for medical use right now. I mean, most excitingly to me is what the FDA has done in order to get possibly a very successful number, it's not just one or two, number of therapeutics, medicines that can help people that are already sick, help people not get sick. And obviously, you know about the vaccine, and Tony will discuss that a little bit later, but the vaccine is moving along. But this is something that right now, this is what it's incredible. And what the FDA has done, and Dr. Stephen Hahn, who's highly respected, came as just a highly respected man. He's been fantastic. He's only been here for a couple of months, and he's gotten thrown into the swim of it, and he's really standing up. But the FDA has really moved the mountains. I said it this morning. They moved mountains to get approvals on things that maybe work. We'll find out very soon. It won't take long. An example of the Pernod Ricard, which is this is really an example where we're repurposing alcohol. They went out and repurposed their alcohol production capabilities in Arkansas, Kentucky, Texas, and West Virginia to make hand sanitizer. That's a big difference. And they've been unbelievable. They really have. Pernod Ricard. Their first delivery will be on Tuesday. It's going to go to various states. They're going to start, I think, in New York, and they're going to work their way around. They're making a tremendous amount of hand sanitizer at a very high level, too, by the way. We've activated the National Response Coordination Center to level 1. That's your highest level. This is the nerve center of all of our government response to crisis, and it's coordinating very closely with our nation's governors. Many of you were at the call yesterday with the governors, and I think you can see the relationship, and we've had numerous calls with governors, by the way, but the relationships are pretty amazing. They're loving what we're doing, and the coordination between the federal government and the governors, states, and even local has been pretty incredible. FEMA Administrator Pete Gaynor, who is with us, will soon be providing you with an update on the center's operations, and FEMA's been incredible. We got them involved last week, very much involved, and now they're involved nationwide. We've dramatically expanded telehealth so Americans can see a doctor without leaving home, something which more and more people are using, and now they're really using it, and now the ones that are using it are loving it. And I think we're going to change the way our country functions medically and probably in other ways because of what's going on right now. This will reduce the chance of infection and preserve hospital capacity, so it solves a lot of problems. Every American has a role to play in defending our nation from this invisible, horrible enemy. It really is. It's an invisible enemy. And we will be successful, very successful, hopefully very much sooner than people would even think. So we say stay at home and save lives. There's a time of shared national sacrifice, but it's also a time to treasure our loved ones and to take stock of what is most important, our faith, our families, our neighbors, and our great country. And I want to thank all of the incredible people of our country, the citizens of our country, that what you've done and the way you're responding has just been very special, something that we will never forget, that the history books will never forget. And we're going to have a great victory. We're going to be celebrating a great victory in the not too distant future. And I just want to thank everybody. And now I'll introduce our Vice President, Mike Pence, who's led the task force. And I will tell you this, he has not slept much, maybe a tiny bit, maybe a little bit, but not much. And he's done an incredible job. Mike, thank you. Please.
Good afternoon, all. And thank you, Mr. President. The White House Coronavirus Task Force met today. We briefed the President on our latest recommendations. We continue at the President's direction to lead not a whole of government approach, but a whole of America approach. You just heard the President describe one inspiring story after another at the way the American people are responding, the way American businesses are responding, religious communities across this country. The American people are coming together. They're responding with common sense, compassion, and generosity. People are heeding the advice of state and local authorities, and tens of millions of Americans are putting into practice 15 days to slow the spread. We are officially, Mr. President, 6 days into our 15 days. And as we look all across this country, while we strongly support the decisions that governors in states where we have significant outbreak have taken, we encourage every American to listen to those state and local authorities. For every American, this is what you can do to make a difference over the next week and a few days to protect your health, protect your family's health, but most especially slow the spread and the potential for the coronavirus to impact the most vulnerable. As the president said, we've almost been overwhelmed at the outpouring of support from American businesses. The president spoke yesterday to thousands of small businesses. We spoke to manufacturers yesterday, and in fact, as the president indicated, the FDA in record time just approved one manufacturer that will be producing millions of surgical masks in a matter of weeks for the American people. The pastors we spoke to, we want to thank all the religious leaders from every community of faith in the country, making the hard choice to suspend services, to have online services, even while those ministries are continuing to support food banks and come alongside the most vulnerable. And of course, the chorus of prayers that is coming up from communities of faith around the country is making the difference that it always has in the life of this nation. One thing the president and I promised was to remind people that on the weekends that you're not in the pews, it's still a good idea to, if you can, to go ahead and make that donation. Because all the ministries are continuing to play a vital role in our communities, and we encourage your continued support. The president and I are grateful that the American people are listening to state and local authorities and putting into practice all of the recommendations in the president's coronavirus guidelines. And as you will hear in just a few moments from Admiral Gua, testing is expanding rapidly across the United States of America. State-run drive-thrus are expanding across the country. And as you will hear detailed this morning, now more than 195,000 Americans and more who have been symptomatic have been tested. That number does not include county hospitals or healthcare labs around the nation, some 15,000 in number. And among the number of the more than 195,000 that have been tested, it's important to remember that only 19,343 at this moment have tested positive for the coronavirus. We continue to urge state and local health authorities to contact FEMA for all the latest developments and innovations in testing. But we want to remind Americans, as Dr. Fauci will emphasize in a moment, if you don't have symptoms, don't do a test. It is another way that the American people can make sure that we are preserving the resources that our healthcare workers need to minister and to support those who are dealing with the coronavirus and other illnesses. In a moment, Pete Gaynor will detail the efforts at FEMA. Since the President's national emergency declaration, we have FEMA in the lead, stood up the National Response Coordination Center, as the President said, and we are working closely, literally hour by hour, through FEMA, processing requests from states most impacted, like New York, Washington State, and California, and we'll continue to work very, very closely with those states through the very traditional means of federal emergency management at FEMA. Secretary Carson will describe decisive actions the President alluded to bring foreclosure relief to Americans. And on the subject of supplies, in a moment you will hear of not only the progress that we're making on testing, but on Monday we'll be detailing for the American people the progress that we are making on the President's strategy of procuring more personal protective equipment and medical supplies, allocating them through the system of FEMA, and continuing to urge conservation by Americans. In fact, I'm pleased to report to the President today that HHS just placed an order for hundreds of millions of N95 masks that will be being made available to healthcare providers across the country. On behalf of the President, we do renew our call for Americans to postpone elective medical procedures, including dental services. And remember, this is another way that you're going to make sure that medical supplies are available, because by postponing elective medical procedures, you're freeing up medical supplies for those dealing with the coronavirus. As the President mentioned, our team is on Capitol Hill as we speak, working with members of Congress in both political parties. They're making progress, by all accounts, on a bipartisan bill. They worked late into the night last night, started early this morning, and we are working to pass that legislation on Monday in both the House and the Senate. Now, on a personal note, many of you may have been made aware that a member of my staff has tested positive for the coronavirus. We learned of that late yesterday. I am pleased to report that he is doing well. He had mild cold-like symptoms for about a day and a half, has not been to the White House since Monday. Neither the President nor I had direct contact with that staff person. We worked immediately with the White House physician and the CDC. We've done all contact tracing. And while the White House doctor has indicated that he has no reason to believe that I was exposed and no need to be tested, given the unique position that I have as Vice President and as the leader of the White House Coronavirus Task Force, both I and my wife will be tested for the coronavirus later this afternoon. Let me say again how grateful the President and I are that every American has acted on the President's coronavirus guidelines. We are 6 days into 15 days that, as Dr. Fauci may well reflect in a moment, is an opportunity for us here on the footholds of this epidemic curve in our country to literally lower the impact in our nation and save lives. Every American can do their part to slow the spread, and we encourage you each to continue to do that. As the President says often, remember, we're all in this together. And also remember that for most Americans, the risk of serious illness from the coronavirus remains low. The reason we want to put into practice the President's coronavirus guidelines is because no American would want to inadvertently expose someone who is vulnerable, a senior with a serious underlying health condition, to the coronavirus with a potential threat. I did hear one story this morning, Mr. President, about a senior named Geneva Wood. She actually is at the Life Care Center in Kirkland, Washington. She is not only a grandmother, she is a great-great-grandmother, 90 years young, and she tested positive for the coronavirus on March 6th. But by all accounts, she's doing well. She wanted America to know there is hope, and her strength and her enthusiasm is truly an inspiration to the nation. As the President said many times, we're going to get through this and come out stronger than ever before. And we'll get through this as Americans together. Thank you, Mr. President.
Thank you very much. Thank you, Mike.
Thank you, Mr. President, Mr. Vice President. As I told you earlier last week, we are in the process and are effectively transitioning to large-scale testing by leveraging all the components of the American healthcare system. When we started, it was CDC only. Then it was the state public health laboratories. Now we're transitioning into the mainstream of American testing with many of the companies that the President invited in the Rose Garden just a week ago. So currently, 91 public health laboratories, state public health laboratories, are up and running in 50 states, the District of Columbia, Guam, and Puerto Rico. This is our curve, and I want to be very clear about this, that this only accounts for CDC, state public health laboratories, and the laboratories that are members of the American Clinical Laboratory Association. These are the main reference laboratories: LabCorp, Quest, Mayo, ARUP, BioReference Labs, and Sonic Healthcare. It does not account for the well over 10,000, 15,000 hospital-based labs, many of which are doing testing, for whom we will get data this week to give you an overall roll-up. As you can see, over 195,000 people in America have completed their testing. That means test plus results. This does not count the people whose tests are in process And as you see this curve is going, it will continue to rise dramatically over the next period of time. So again, this is utilizing all the components of the great American healthcare system, the state and local public health laboratories, the hospital system, which is not represented here, and the main reference laboratories. Now, I do want to make it clear that although testing is becoming more available, and Dr. Fauci will definitely emphasize this more, there are priorities for testing. And clearly, everyone across the country should understand that those hospitalized or in an ICU are a priority for testing. Symptomatic healthcare workers, for obvious reasons, we want to make sure that their health is preserved and that they are not going to spread to those who may be seriously ill. Symptomatic people in long-term care facilities. As the Vice President has highlighted, and we've said many times, elderly in our society have a much higher mortality rate, much higher serious complication rate. Symptomatic individuals over 65, symptomatic individuals who have underlying conditions like chronic heart disease or liver disease or other types of chronic diseases, patients in public health investigations, and there are local priorities around the country, particularly healthcare workers for testing. And Dr. Fauci is going to emphasize this about the types of people who may not be to be tested. Testing is going well, it's ramping up, but we should still have priorities. Finally, I want to talk about the community-based testing sites. I know they're popular now because there's now an acronym, which I'm sure the Vice President doesn't appreciate, CBTS or CBT sites. We talked about these earlier in the week, and I wanted to emphasize again that these are state-managed and locally executed. The federal government is there to provide support, know-how, blueprints on how to do this, but these are really springing up at dozens and dozens of sites all over the country, adapted to the local needs. Some are drive-through, some are walk-up, some are geared to healthcare workers and emergency responders.
In other words, they're taking it at a case-by-case basis, depending upon what area that you're in, what neighborhood you're in, whether or not you're coastal, intercoastal, whether or not you're up in the mountains, whether or not you're down in the city, whether or not you're out in a suburban area.
So again, what we see in the upcoming week is this curve will continue to increase as testing becomes more widely available, as the great American healthcare industry continues to increase the availability of tests and the throughput of those tests. Thank you, sir.
Thank you very much, Edwin. Dr. Fauci, yes.
Thank you very much, Mr. President, Mr. Vice President. What I want to do just over the next minute or so is maybe connect some of the dots of the things that you've heard today. First,
Please do, Doctor.
The
Please do.
dynamics of the outbreak. I mean, you all know the numbers. You've seen them. We have widespread infection, but to
Apartments.com puts more renters in new homes than any.
you talk about the
What
kinds
the
of
heck?
mitigation issues that we have put forth and have emphasized. Just as I mentioned the other day, there are two dynamic forces that are going on at the same time. You're having the natural course of an outbreak trying to peak at a high level, and then you have the mitigation strategies which are aimed at dampening that. We've mentioned that multiple times. We often get asked, how do you know you're having an effect? Because there are two things that are going on at the same time. They may be confounding. Well, I can tell you for sure, from a public health standpoint and experience with other outbreaks, we know we are clearly having an effect, but we can't quantitate it for you accurately now, because looking forward, you'll know what the impact of the rate of these steep inclines will be. So that's why we're going to come back to you every day and keep you up to date about that. Getting with regard to the disproportionate of the response, everyone, it's right here, I'll get to open up the Vice President's book with his permission. This is baseline for everyone. In other words, throughout the country. But then there will be areas, and you've heard them, Washington State, California, New York City, in which the dynamics of the outbreak are clearly different and much more robust, if you want to use that word. And that's the reason why we've seen the mitigation ratcheted up in that regard. And again, hopefully, and I have confidence it will happen, you will see an impact on that. Next, getting to testing. You saw the numbers with testing. Remember, there was always an issue with testing. I think we're getting to the solution that everybody in the country is looking for. But I want to emphasize one thing that Admiral Giroir mentioned. is that not every single person in the United States needs to get tested. He gave you the priorities. I don't want to repeat them, but let me tell you one of the unintended consequences of individuals who don't need to get tested that flood the desire to get tested. Currently, and I hope we'll be able to change it and make it much less reliable on PPEs, when you go in and get tested, you are consuming personal protective equipment, masks and gowns. Those are high priority for the healthcare workers who are taking care of people who have coronavirus disease. So what we don't want to do is to have a situation where we do have disparities in availability of PPEs now, and we're working hard to correct that. But currently today, we want to make sure that the people who are taking care of people with coronavirus disease do not endanger themselves because they don't have the personal protective equipment. And then finally, one last thing was just mentioned, the Surgeon General has been pushing this. Please put off, cancel elective medical and surgical procedures. You don't want to not ever do them, but for the time being, don't do them, because they also not only consume personal protective equipment, they may also consume some of the things like ventilators that you might need. So let's pull in this together and we will get through it. I promise you. Thank you.
Thank you, John, very much.
Thank you, Mr. President, Mr. Vice President. FEMA is now leading the federal operation, or the federal response for all operations on behalf of the White House Coronavirus Task Force, who oversees this whole of nation response. HHS will continue to provide their matter expertise on health, and pursuant to the nationwide emergency declaration, FEMA, in coordination with HHS, is assisting state, local, tribal, territorial governments and their other eligible entities with health and safety emergency protective measures on behalf of the American public. As of yesterday,
See what I'm saying? They deal with tribal territories. Once they get their hands involved in something, they become a government in a government. And they can actually have more power than the federal government, depending upon the circumstances of what's going on. That's the reason why I literally shudder whenever they come on board. Because while I was down in the Katrina, you had to go to school and you had to learn about asbestos. You had to learn about being involved in around a house that possibly had a dead body and exposing dead body. You had to learn about various chemicals pertaining to aspect and other things that you had to learn about towards being dressed up in a suit and wearing a mask. It was mandatory. They didn't ask you to do it. They forced you to do it. And if you didn't do it, you didn't participate in what they wanted you to do. They are a dictatorship. They tell people what to do and how to do it. They exceed the authority over an incident whenever they get called on board. That's the reason why I don't like these people. They done a miserable job during Katrina, especially down in the Louisiana, lower Mississippi area that was just overwhelmed. And I guess the reason why that they done such a sorry job was because of that administration that was in power at the time done a miserable job in doing what they were supposed to have done. And one calamity added to the other to the point that it was just a catastrophe. And if it wasn't for the volunteers towards getting on the boats and going and rescuing people, whenever we seen the shadowing images of people being stranded on their rooftops because their homes have been flooded, their neighborhoods have been flooded. If it wasn't for the volunteers that went out on the limb and going and rescuing people, it would have been a much, much worser, horribler of an event than what it turned out to have been. FEMA was nowhere around at that time. But once they did come on board, pertaining to the cleanup, you had to follow certain guidelines to do certain things, to be in certain areas, and it was just like martial law. And them at any time could snatch you up and put you in some sort of a containment or a concentration deal, regardless whether it was over you being exposed, or you being disorderly, are you doing this wrong or that wrong? In other words, you followed their recommendations to the T. And if you didn't, you paid ordinarily a severe price for it. It was the same thing as martial law, as far as I'm concerned. The only difference was they was in white suits versus the military walking around in tactical suits. That was the only difference. But trust me, they was out there too. They was out there following orders too, towards where to go and what areas to protect and what areas not to protect. Maybe they have learned their lesson since then, and maybe they are a bit more they're a bit more professional now than what they was back then towards ordering people around and doing things the way that they do them. But I didn't like their behavior at the front end, and I didn't like their behavior on the back end. And it may just be me, it may be a preference thing, but I don't like people ordering people around to the degree of being mandated the same way as it would be if you was in a communist control country. And if I'm looking at it in the wrong perspective, then I apologize. But from what I've seen, they exacerbated the problem rather than being there and mitigating the problem. That was just my opinion towards what went on during the time of the Katrina damage, whenever I was down there, give or take, for about 6 months. I got to look at the fundamentals towards the who, the what, the when, the why, doing the major cleanup, counseling with people, talking with people, leading people to the Lord, giving people a different aspect of a sense of hope pertaining to hope beyond this world, and people being ushered into the next world. Suicide cases was off the charts down there for, I know, 4, 5, 6 months. Seeing how the insurance companies was raking the people over the coals just added that much more insult to injury towards what I was seeing. And like I said, it was just like a third world country. It was just like a third world country, the way that it was being handled and run, and seeing God only knows how many hundreds of thousands of dollars worth of equipment that people had brought in, and because of the Mississippi laws and because of the Louisiana laws, basically people just walked away from their equipment and just left it. Just left it. I even went as far as retitling my truck in the state of Mississippi, knowing that I was going to be down there for so long towards becoming a citizen. I wasn't just working in the Katrina kitchen. I wasn't just doing things for FEMA and the Corps of Engineers, but I was spread out towards doing a lot of different things. There at the last, I started working in the body shops towards doing body work in three different body shops while I was down there, before I finally decided, well, my needs is no longer necessary. I'm going to leave. So I basically spent a long period of time down there hearing testimony after testimony after testimony how people basically got ruined by their own insurance companies of debating whether or not they had flood insurance versus hurricane insurance. And for the legislation in that area to have allowed something like that to occur was absolutely sickening on every level. On a local level, a state level, and a federal level. And to this day, may people like Dick Cheney rot in hell because of the way that it was handled down there pertaining to the Katrina damage, and FEMA and the Corps of Engineers and everybody else that took a part in that catastrophe down there. May they rot in hell because of the way that they basically went in and prospered and profited off of people's misery and off of people's sorrow. May people like Dick Cheney rot in hell because of what they done. It was a disgrace.
50 states, the District of Columbia, 5 territories, and 1 tribe are working directly with FEMA under the nationwide emergency declaration for COVID-19. In just 24 hours, we've obligated $100 million to states, territories, and tribes. A little bit about supplies. It is of the utmost importance that requests for assistance, especially for critical supplies, get routed through proper channels as soon as possible. And we ask everyone to follow the normal procedures FEMA uses in a natural disaster. There's no different procedure for the COVID-19 pandemic. But remember, you can still order supplies from your regular vendors and buy it on the open market. Buy it where you can find it. We will reimburse you. If you buy medical supplies from foreign sources, it is reimbursable. Buy America does not apply to the Stafford Act, except for Washington, D.C. and Puerto Rico. If you can't buy it on the open market, make a request through the FEMA system. Requests for assistance at the local and county level should first go to states, from states to the regional FEMA offices, and then from those offices right here in D.C. where the National Response Coordination Center is open and running. We are getting requests for masks, PPE, swab sets, test sites.
Now, under the Stafford Act, pertaining to the personnel side, he just mentioned some things that are probably very good and decent. Those was areas that I didn't have to touch off on during the time that I was down there doing the cleanup and working with these people. They are under the Stafford Act whenever they get engaged pertaining to these events that are major. And I'm sure that this event that's going on right now, in comparison to the cost and the size of Katrina, will only be a drop in the bucket in comparison to what they're dealing with right now on a grand national, international level, especially whenever you're involving CDC and other federally known internationally institutions that is basically in charge of world affairs. Not just national affairs, but world affairs. These are some very, very powerful organizations, institutions that are backed up. I'm going to say, go as far as to say, probably backed up even through the United Nations, pertaining to what that they do and how that they do it. I may be overstipulating in what I'm saying right now, but I bet you the United Nations has a big deal to do with, once you reach this level, the United Nations could step in. That is what I'm afraid of. That this could escalate into a United Nations act that would exceed any medical procedure to the point of there being martial law. That's the part that bothers me about something on this scale. God forbid if it escalates into that seriousness of an event. And of course, if it does, throughout the summer months, I don't know how that it's all going to unravel. I don't know if it's going to get worse or better because of the summer months approaching. Sometimes these viruses have a tendency to weakening or becoming less effective because of the summer, the heat. But you don't never know until you experiment with it of seeing what it actually does. We're in uncharted territory right now. We are in uncharted territory on a local, state, and federal level.
Ports, ventilators, hospital capacity assessments, and many more. We are in lockstep with HHS to answer these requests, but we will do whatever is necessary to get states, tribes, territories, and others what they need. And then finally, what we are doing here in Washington, D.C., again, this is a whole of government response. Like all emergencies, response is most successful when it is locally executed, state managed, and federally supported. We can't say that enough. On Thursday, our federal partners fully integrated with our National Coordination Response Coordination Center, and additionally, all 10 FEMA regions across the country have been activated. The FEMA regional administrators will continue to coordinate closely with government.
All 10 have been activated. All 10 have been activated.
Governors, state emergency managers, state public health officials to determine the type and level of support needed to respond to this dynamic threat. Thank you, sir.
Thank you very much, Pete. Appreciate it.
Ben.
Ben, please.
Well, thank you, Mr. President and Mr. Vice President, for your tireless leadership here. And I also want to thank the fellow task force members who have been working around the clock in a very patriotic way to serve their fellow Americans. You know, part of the American dream is having a home. And sometimes people say, well, what does housing have to do with health? It has everything to do with health, having a safe home. And that is the reason that the President has authorized the immediate cessation of foreclosure and eviction proceedings for American citizens, single-family forward mortgages, as well as reverse mortgages. And as you know, FHFA has also decided to do the same thing for 60 days. And the CFPB is very happy with all of this as well. And it's really all about helping our people, recognizing that they're being severely impacted by the coronavirus. And we've also asked the various servicers of mortgage loans to exercise forbearance for anybody who's having difficulty. It is important, if you're having difficulty, to actually contact the people who have made the loan, who established the mortgage, because it doesn't happen automatically. What does happen automatically is that we cover all 8.5 million people in terms of the moratorium on foreclosures and evictions. We want also for the PHAs to be protected. HUD does not have authority to mandate that evictions can occur, but we are in contact with all the PHAs across the country, and are petitioning Congress for the power to be able to actually enforce that. But the fact of the matter is most of the PHAs are run by people who actually care about other people. So we really haven't seen much of a problem there. We haven't seen much of a problem with forbearance and needing to try to force people to do it because they want to do it. People are stepping up and saying, what can we do to be helpful? As far as housing choice vouchers, Section 8 is concerned, the April vouchers will be sent out next week. May vouchers are already being worked on. And we're also staying in contact with all the stakeholders, the advocates for low-income housing, as well as other stakeholders to make sure that we're doing things that are most helpful to them. And additionally, we've extended the deadlines for healthcare and multifamily financial reporting requirements. And that's for over 20,000 multifamily and healthcare borrowers until April the 30th. And that provides them with a lot more flexibility to deal with the issues that they're dealing with. I also want to thank our FHA Commissioner Bryant Montgomery, as well as the FHFA Director Mark Calabria, and Kathy Kraninger, the Director of the CFPB, who've all worked tirelessly with us to make this happen. What we're trying to do is bridge the gap, recognizing that it's a lot easier for us to take these measures and for Congress to take the measures that they're taking so that we don't destroy a very excellent system and have to start all over again. So for those who are worried about the money that's being spent, if you don't spend the money and deal with this now, it's going to cost a whole lot more to try to build all this up again. And as was mentioned by the president, there's been a sense of unity that we haven't seen for a long time in this country. And let's hope and pray that that unity lasts far beyond this crisis.
Okay. Ben, thank you very much. A few questions, please.
Mr. President, a few questions, if you don't mind, sir. If you've lost your job now, or you're worried that you're going to lose your job tomorrow, restaurant, something like that, what do you want people to do immediately? The second question, sir, you heard from the Vice President that he's going to be tested. Have you taken a test since last Saturday? I know you told us.
I just took one.
You just took one. How are you feeling?
I feel great.
Okay.
I
guess we'll.
I hope I look good. It's like in more than one. Those people are going to be.
Sorry, hold on. Yeah. Okay, so for those people that have lost their job already, or they're worried that they're about to lose it tomorrow, what do you want them to do right now?
Well, what they do right now is keep receiving their paycheck, and hopefully their companies are going to be in a very strong position. We want to keep everything together because we think we're going to have a tremendous bounce back. Now, some people agree with that very strongly. Some of our top economists, they think we're going to have once we solve the problem that we're working on, the medical problem. So we want them to keep their jobs, stay where you are, and we'll see what happens. Now, if they don't, we have unemployment, we have checks, we have a lot of things happening, a lot of very positive things. Nobody has ever done. Now, this is working with Democrats, this is Republicans and Democrats, and myself working together. Nobody's ever done a package like this. It's a great package, but ideally we want them to be able to keep their jobs, keep the pay coming, and I think that's going to happen. Kelly, go ahead.
Mr. President, on your Defense Production Act power, one of the features of that is that the federal government would be able to control the output, whether it's masks or ventilators,
Right.
get it to the most areas of need, and control the pricing to keep it at a market level so it's not price gouging. One of the things we're hearing from governors, they can't find supplies and prices have gone up. So you've talked about the act, sir, but you have not yet compelled any companies. Why not?
Because we have so many companies making so many products, every product that you mentioned, plus ventilators and everything else. We have car companies without having to use the act. If we don't have to use specifically, we have the act to use in case we need it. But we have so many things being made right now by so many, they've just stepped up. In fact, Mike Pence and I were discussing it before. We've never seen anything like it, where they are volunteering. We want to make masks. We want to, like Hanes, I brought that up as an example. General Motors, I bring that up as another.
They're on the
Ford.
open market, sir, right?
They're going to go in the open market. We want them on the open market from the standpoint of pricing. because otherwise it's going to be, we could be very unfairly
Direct
treated.
them to the places in greatest need.
We are directing states, and sometimes we'll be competing against states, which I don't want, and we'll drop out of the bidding. We want the states to go first. And you know, what we're doing is we're helping states. That's what we want to do. Same thing with the testing. We're helping states. We're helping states get to where they want. And we've made tremendous progress in every aspect of
This
it.
happens for
It's
governor
happening
that needs
fast now.
equipment today.
Well, it's happening fast right now, and the governors are out there trying to get, and if they are competing with us, we immediately drop out, please.
Mr. President, forgive me if I heard you wrong at the beginning, but you said something, we are going to be going over to the Hill. Are you going yourself?
My people are, and I'll be staying here. I'll be in the Oval Office and various other places in the White
And
House.
on that matter, you're asking Congress to essentially pass a series of legislation that's going to amount to about $2 trillion, 10% of the GDP. What do you say to members in both parties who say this is too expensive, this is just too much to debate and get done in 48 hours or so? And also, have you spoken directly with Speaker Pelosi at all about any of this?
Okay, so I've spoken with, I'm not going to say who I speak with, but I've spoken with directly or indirectly everybody many, many times. We're doing very well. I think the Democrats and the Republicans are going to come up with a package that's going to be really something very special. It's going to help people. This is the first time there's ever been a case where you want people not to work. It's always, you know, you want to create incentive to work. We're creating not an incentive not to work, but the fact is we're asking people not to work because of, they have to stay away from each other. If we're going to kill this horrible hidden enemy, we have to stay away. So there's never been a thing like this in the history of the world. And other nations are doing similar things, some effectively, some not effectively. They're doing similar things. We are creating a package that's going to keep companies together, keep workers paid so they can live and sustain. We'll see what the timing is. The biggest thing we can do is get rid of the problem. The problem is exactly what we know, the medical problem. We want to have this whole incredible situation that it can start right away. Not that all these companies break up, all the workers are out of jobs, you can't put them back together, and it would take years to put them back together. Because we had the greatest economy in the history of the world until we got hit by this problem. And we can be back very, very quickly. And it's our intention to be back very, very quickly. So we're doing a package, the likes of which nobody's ever done before. I'm obviously the one that has to approve the different things and the recommendations of the different things. And like buybacks as an example, and stock buybacks, I didn't like it the first time, and this time I'm saying, you're not doing it. I don't want money to be used for that. I want money to be used for workers and for opening businesses, keeping businesses, not buybacks. And well, I am strongly recommending a buyback exclusion. You cannot buy back your stock. You can't take $1 billion of the money and just buy back your stock and increase the value. Please.
On the subject of masks, the Vice President announced HHS was ordering hundreds of millions of them. Was that order just placed today? How is that going to be distributed, and when can doctors and nurses expect to actually receive those masks?
Yeah, HHS is completing a $500 million order of N95 masks, and all of this is being coordinated through FEMA, and we are responding specifically to state requests where the needs arrive. As Dr. Fauci said, we want to make sure that people that are providing healthcare services to people who may have contracted coronavirus have the protection to keep themselves and their families healthy. But I want to emphasize the supply of so-called N95 masks has been vastly increased in the country because the president insisted that we extend liability protection to industrial masks. What all the experts told us early on was that industrial masks that are used on construction sites, the president's very familiar with from his past life, are perfectly appropriate to protect healthcare workers from respiratory illness. But they didn't have the liability protection because they weren't created for hospitals. We worked with leaders in both parties. We added that protection that runs through 2024, that now the industrial N95 masks can be purchased by hospitals, purchased by states, purchased by HHS, and distributed through our system. So we're making those available. The supply has been, as I said, vastly increased, and it was another a step forward and a bipartisan accomplishment. And we're continuing to use all the kind of creative means of American industry to make sure that we're leaning into this effort and that we do whatever it takes to make sure that our healthcare providers have the protective equipment.
We are still hearing from doctors and nurses about this shortage. When exactly can they expect to receive these masks, though?
Well, let me let Pete Gaynor speak to that, because FEMA will be, HHS is now fully integrated into FEMA. And so as the requests come in, but obviously, as I'm sure the administrator will say, they're being prioritized to those areas with the highest need.
Yes, sir. So within the National Coordination Center, we have a supply chain task force. And in basic sense, we're trying to identify the universe of what's out there. So whether we hold it at the federal level, we hold it in the private sector, and then match that up with demand and asking people to be creative. We're asking, again, this is a shared responsibility. We're asking locals and states to do your share locally, try to take a little bit of burden off of us, and then we'll prioritize those scarce resources, because every single governor across the country is looking for the exact same thing. So there's a balance, but we're examining the entire supply chain to make sure that we make
masks start coming in.
They're out there now. So again, we want to match. We want to get out of the middle, I think.
That's what I like.
So we're trying to match suppliers with demand. So that's what we're doing right now. It's happening today.
They can expect them today, or they're matching supply and demand.
There's a range of requests across the country, and we're trying to match those again, supply and demand every day.
We have a lot have already come in. I have to tell you, the throwing away of the mask, being in private business, the throwing away of the mask right away, they're thrown away. And when you hear 55 million masks were ordered, I'm saying 55 million, how could it possibly be such a number? And they say, oh, that's just a small fraction of what we need. And I said, why aren't we sanitizing masks? You know, you look at the masks, I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks. And that's something they're starting to do more and more. They're sanitizing the masks. And I don't know if anybody would like to speak to that.
Yeah, there are CDC guidances about how you can minimize the use of masks by different things that you could do with testing, and when you have masks, how you might reuse them, which ones you can reuse them.
Do you think there's a solution to this other than buying more masks? Do healthcare providers need to change how they're using them?
Yeah, well, there are a couple of things. One, for example, we are moving towards getting testing where you don't have to have PPE. I mean, I'm not going to tell you the day is going to be there, but it's going to be a swab that you could stick in the nose of the person who is either infected or not, but that person doesn't need PPE, the person who's administering the test. So if you could do a self-administered test, stick it in a vial, hand it over. You don't need a mask, you don't need PPE. That's one of the things we're trying to do.
I would have liked that much better. Personally, yeah, go ahead.
May I? And one other, this is another story about great American industry. I mean, the president and I literally heard directly from Apple that they're donating 2 million industrial masks to this effort around the country,
yes,
and working with our administration to distribute those. And it might be a good opportunity for us to renew our call as the president and I delivered this message to businesses yesterday, manufacturers and small businesses. It's a great time to go to your storeroom, and if you have N95 masks, if you've got 100 of them, if you've got 10,000 of them, is to load them up, drive them over to your local hospital. That story is literally happening all over the country. And now with more Americans stepping away from elective surgery, including elective dental care, we're urging dentists around America to look at their supplies of N95 masks and make those available to our hospitals. But the great news is, as the president said, the American people are all doing this now. So allow me to say on behalf of the president, thank you for what you all are doing today, but we want to encourage people in business, encourage people in dentistry in particular. Look at those supplies of N95 masks. Pack up as many as you could spare, drop them off at your local hospital. It'd be a great service to the country.
Mr. President, I just want to read you some of what some of the doctors on the front lines of this crisis are saying.
You mean the ones that are saying good things or bad?
These are doctors who are talking about the shortage of medical supplies that they are facing. Dr. Faiza Bucks in Kentucky says there's absolutely no way to protect myself. A surgeon in Fresno, California says we are at war with no ammo. Dr. Mel in Illinois says if this is a wartime situation, then now is the time to act. I know you're talking now about increasing production at so many of these facilities to get the masks out, but given that this is one of the wealthiest, most powerful countries in the world, should this even be happening? Shouldn't this have been resolved weeks ago?
I'll tell you the way I look at it. So many administrations preceded me. For the most part, they did very little in terms of what you're talking about. This is unprecedented. You could speak to Tony, you could speak to anybody. This is unprecedented or just about unprecedented. As time goes by, we're seeing it's really at a level that nobody would have believed, nobody would have thought possible that this could happen. And we are making much of this stuff now, and much of it's being delivered now. We've also gotten tremendous reviews from a lot of people that can't believe how fast it's coming. I mean, when I hear they have an order of 55 million masks, and that's just one order, that's one order out of many, and that there are many millions of masks beyond that and I keep saying, how is it possible to use so much? But that's the way it is. And part of that is because they'll use a mask for a short period of time and they throw it. The fact is that we are doing a tremendous amount. We started with very few masks. We had some, but nothing for an event like this. And now we're making tens of millions of masks and other things. And I think it's unprecedented what we've done and what we're doing. And many doctors, and I've read many doctors, they can't believe the great job that we've done. Yes, Kelly, did you have?
It's been nearly 3 months since your administration learned about this virus.
Well, if you remember, I was the one that closed the country down. I was the one that closed the. You don't write that, or you don't say it too much, certainly on CNN. But I just read an article yesterday. That by closing the country down so early, very early, we saved tens of thousands and much more than that lives. So. You might want to report that too.
I'd just like to address that for a moment. Again, I'm an ICU physician, ran health systems, and I first of all want to thank everyone who's on the front line in the emergency room, in the ICUs, in the hospitals. I speak to my colleagues daily. We need to preserve our PPE to the degree that we can. CDC guidelines has had that. The president has talked about it. But I also want to say we are making product, as the president said, but we are also responding through the FEMA system to distribute the strategic national stockpile resources according to requests that come in. Stockpile has been distributed to many states, first orders, second orders, and on a daily basis adjudicating that. If there are shortages in your hospital system, I can't tell you of Dr. X, Y, Z, that needs to be clearly iterated to the local emergency management.
Are you seeing those hospitals talking about
we were on the phone 2 nights ago or 3 nights ago with over 2,000 hospitals or hospital systems sharing best practices from Seattle, where they've been very innovative, pioneering some of these areas. When there is a shortage, they need to go through their emergency management. It goes directly up to the FEMA system, which really rocks. It really works very, very well. And then there's a distribution of the stockpile. Now, the stockpile isn't infinite. That's why it's being replaced by all the orders. But mask supplies go out on a daily basis as they are needed and requested through the FEMA system. I don't know, Administrator Gaynor, whether you want to add to that.
Just to reiterate what Brett said, we don't take lightly what you just read. I get the calls every night, the way you get emails. It's a serious issue. We don't want that to happen, but it is happening. You're not making things up. I know that because I'm experiencing myself. But what you just heard about the different avenues, some of which aren't even recognized, about how you can get help through the FEMA process, in addition to the large amounts of additional PPE that's coming into the system. We hope that very, very, very soon we're not going to get those kinds of real life difficulties. Yeah.
Like there's a question about the timeline here, and even FEMA can't quite answer what the timeline is. Days, weeks.
Yeah. Sooner than weeks. It's going to be days. I would hope. You know, we're going to try to make it days to the best possible way we can.
And again, what we're doing is we're trying to help the states get things faster. And that's what we're doing. We're implementing. And the magnitude of this, it's a tragedy. It's an absolute tragedy. But the magnitude is something that no matter who you were, no matter where you come from, nobody ever thought a thing like this could happen. You read about 1917 and you read about certain things, but you think in a modern age a thing like that could never happen. Well, it comes back. It is genius. It comes back, and it's too bad. But I think the people working on this have been incredible. The job they've done has really been incredible. But there's tremendous amounts of not only masks, of ventilators and respirators and everything you can think of. It's all being, much of it and almost, I could say all of it is being manufactured right now. Steve, please.
Yesterday there were questions about the use of this malaria drug. Have those questions now been resolved?
Well, I don't know that resolved. I could say that it's going to be distributed. I know New York is getting, I think, 10,000 units and numerous other people. It's really, it could be the malaria drug plus the Z-Pack. But, and we're going to find out. We're going to find out. I feel, look, I feel, as the expression goes, what do we have to lose? Because, you know, I feel very good about it. Tony would feel, you know, like he likes samples done in a certain way, and I understand that too. Many doctors agree with that. We don't have much time. You know, we have a lot of very sick people right now in hospitals all over the place. And speaking with the governor, New York, Cuomo, I said, how's it look? He's got a lot of sick people. So we're going to be delivering a lot of samples to New York and other places, and we're going to find out very shortly whether or not it's going to work. I feel very confident. I mean, I've seen things that surprised me, frankly. There are, as Tony said, there are other things we're looking at too. Vaccine, of course, is incredible, but this is more immediate. Right now, this to me would be the greatest thing that could happen. This would be a gift from heaven. This would be a gift from God if it works. So we're going to pray to God that it does work. It would be a fantastic thing.
Mr. President.
Yeah, please, Rebecca.
Mr. President, on the economic front, there are reports that the coronavirus is really hurting your businesses, especially your hotels.
My businesses?
Yeah,
Sure.
so is that true, and can you speak
Well,
to
I wouldn't say it's
financials?
thriving when you decide to close down your hotels and your businesses. No, I would say, but you know, I'm very under-levered and everything, so that's good. But is it hurting yeah, it's hurting me, and it's hurting Hilton, and it's hurting all of the great hotel chains all over the world. It's hurting everybody. I mean, there are very few businesses that are doing well. Now, there are some that are, like as an example, the Walmarts of the world, because everybody's lined up to get things and stock up their house and this and that. But sure, it hurts my business. But
Did you or anyone in your administration talk to anyone at the Trump Organization about the potential effects of the coronavirus?
no, I didn't speak to anybody. I speak to my sons, but I talk about the coronavirus, but not as it pertains to my business. They basically follow the rules. When they say close them down in New York, we close them down, or wherever they may be. I actually have them all over the world. And when they say close them down, we close them down. What, Kelly?
Will you no longer go to Mar-a-Lago or Benton?
Well, I have nothing planned at Mar-a-Lago, but right now I think Mar-a-Lago, I guess, I haven't even asked, but I imagine that's closed down just like a lot of other businesses in Florida. Right?
Do you expect your company to seek government assistance if it's eligible?
I don't know. I mean, I just don't know what the government assistance would be for what I have. I have hotels. Everybody knew I had hotels when I got elected. They knew I was a successful person when I got elected, so it's one of those things. I guess I get paid $450,000 a year. I give it up. I put it back into the nation. I have to, by the way, you have to designate where you want it, so I oftentimes give it to opioid, research and things. But as far as the hotels and everything, I mean, I have to do what everyone else is doing. I would probably decide to close things up, I think it's a good thing. You don't want people getting together. And hotels and clubs and everything, you get together. We want to beat this deal. So I have many of them, hotels, clubs, things like that, where people get together. I would think it would be a good practice to close them up. Yeah, go ahead, please.
Mr. President, as you know, we've been talking a lot about masks. We've also talked about how not everyone needs to take a test. What about a temperature test? As we know, we all came into this room and got
Tomorrow, we're probably doing this tomorrow. And if I might, I'd like to ask Vice President Pence to take over. And thank you all very much. Thank you,
Thank you, Mr. President.
Thank you all.
Sorry,
Back here.
Mr. Vice President, the military has sent planes to...
Okay, we've been listening to President
to pick up Americans and bring them home who've been stranded there. But there's still a lot of other Americans who are stranded and can't get home. So does the military plan to send planes to pick those folks up? Where will those planes be going? When will they be going? And can you assure Americans that who are stranded in foreign countries that they will be able to get home?
Well, we received a briefing this morning from the State Department about their efforts. And we want to be very clear. While the President has suspended all travel from Europe, including the UK and Ireland, suspended all travel, of course, from China since January, that any American who can get home can come home. They'll go through additional screening that's all been implemented and is working in an orderly way at a number of airports around the country. But there are instances, Morocco being among them, where there simply are not flights to get home. Our State Department has been working very closely with our embassies in those relevant countries. I was told this morning that all the way going back to bringing Americans back from China, that we have made individual efforts to bring home about 3,000 Americans. I think there is an ongoing effort to address that with chartered commercial flights that the government is providing. Obviously, also military transport is available, but our task force received a briefing this morning, and we would just encourage any American that's looking on from overseas, contact the local U.S. Embassy, let them know about your circumstances, and know that we're going to continue to work very diligently to get our Americans home.
All right, guys, last question. Two quick ones, education and a medication one. You guys have announced that standardized testing is essentially canceled in this country. To the tens of millions of students out there, their teachers and their parents who are sort of scratching their head wondering, well, what does that mean? Obviously, a lot of this is driven by local school districts, by the state. Is there any federal guidance on this? And if not today, could you have Secretary DeVos or somebody come and explain that to the millions who are literally sitting at home trying to figure out what exactly that means?
Well, I think it's a terrific question, and we will bring Secretary Betsy DeVos here tomorrow or on Monday to address our efforts. The objective here was as people are embracing the president's 15 days to slow the spread, we have decisions by local school boards and local and state officials that have canceled school or suspended school for a time. And we wanted the Federal Department of Education to make it clear that the burden of standardizing testing, which back in my days as governor, I remember takes a number of days and sometimes up to a week to administer, is not going to be placed on schools. But we'll have the Secretary here to address that very specifically, and it's a very good point on your part.
I mentioned I had a medication question, and I wanted to ask it while the president was here, because earlier he tweeted that there were two certain medications that when taken together, quote, have a real chance to be one of the biggest game changers in the history of medicine, and that they should be, quote, put in use immediately. Since he's not here, I can't ask him what he meant, but I'm wondering if Dr. Fauci or the Admiral could clarify if you have any sense of what he was talking about, and whether his 74.5 million Twitter followers should be taking medical advice from him or from someone else.
The president brought together the top pharmaceutical companies in America and in the world a number of weeks ago. And they formed a consortium to work on a range of responses. beginning with therapeutics, which for a layman like me, that just means medicine to make you feel better. They're already going to work on that. We actually think, Dr. Fauci, I think there's some sense that that our great pharmaceutical companies may actually be producing therapeutics that will give relief to Americans struggling with coronavirus as soon as this spring. We also challenge them to work together as rapidly as possible to develop a vaccine going forward. And as Dr. Fauci has indicated, we brought a vaccine to clinical trials now the better part of a week ago, the fastest time in history. Now, it's the first phase of the trials, and people should understand, as our health experts have described, that there'll be a period of as much as a year and a half before we can make those vaccines available. But as the president said at this podium, there is some anecdotal evidence that several existing medicines may have brought relief to patients struggling in China and in Europe. And the president has tasked the FDA to work very rapidly to allow what's called off-label use for those. One is a malaria medicine. But this morning, I think the president reiterated the hopefulness that he feels about this, that because these are medications that are time-honored and tested, they've been taken for many, many years, that we want to pursue, number one, making those available if someone's doctor believes that it's appropriate. The doctor would be able to prescribe that medicine even though that's not indicated. That's called an off-label use. But the other piece is, as Dr. Fauci said, and I'll yield to him, in deploying those medicines, we're working specifically with one state to do so in a way that represents a clinical trial. So it would not just be compassionate use, which the medicines are already being used for in some jurisdictions today, but also we could study it and determine the viability of it. And in fact, we're working diligently right now with that supply chain to make sure that those medicines are available. Dr. Fauci, did you want to speak to that?
Sure. You know, it's essentially what I said multiple times from this podium, is that when you have, first of all, we're trying to develop de novo drugs that are not yet out there, not approved, that ultimately would be effective. And the way you prove that is to do a randomized controlled trial to prove safety and efficacy. I'm not totally sure of what the president was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being in effect. Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The president is talking about hope for people, and it's not an unreasonable thing to hope for people. So when you have approved drugs that physicians have the option in a decision between the physician and the patient, are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job as a scientist, to say my job is to ultimately prove, without a doubt, that a drug is not only safe, but that it actually works. Those two things are really not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven. We went through the same sort of thing with a little bit of a different twist during the HIV/AIDS epidemic until we finally developed drugs that were absolutely knockout drugs that were safe and that were effective. But in the beginning, there was that tension about that. So you really got to have a balance. I've got to do my job as a scientist, and others have other things to do.
Great.
Mr. Vice President, question for Dr. Carson? Yeah, question.
Let me just, if I may, let me just say, I hope this morning has been informative. We will be back again tomorrow. And I hope the American people are encouraged because of the incredible whole-of-government approach, because of our collaboration with states. You're seeing testing expanded all across the country. That incredible public-private partnership with commercial labs is now making testing available by the tens of thousands. We're working very diligently with an incredible response from American industry to make sure that personal protective equipment, and ventilators, and all the things that our healthcare providers need to meet this moment is there. But let me just say again, what every American can do today. And that is, first and foremost, heed your state and local authorities. There are individual states, California, Washington State, and at this moment, especially New York, that have issued guidance to their citizens. And as the president said, we wholly support the leadership that those governors are providing in their states. But secondly, every single American can put into practice the principles of our 15 days to slow the spread. The president's coronavirus guidelines, as I said, we're 6 days in, and the purpose of these is not because every American is at risk of serious illness. As we said before, all our experts tell us, all the data shows, that the risk of serious illness to the average American remains low. But because the coronavirus is, we think, 3 times more contagious than the flu, to slow the spread, to literally lower that curve and spare Americans around our country with being exposed to or contracting the coronavirus, or worse, every single one of us can put these principles into practice. I recommend that you go to coronavirus.gov, sit your family down, call a neighbor and a friend, support efforts in your local community to put these principles into practice. And as people all across this country continue to do just that, I just know we'll get through this, and we'll get through this together. Thank you all.
Olivia, briefing tomorrow, sir.
All right, everyone, you're seeing the wrap-up of a nearly hour-and-a-half-long task force briefing there, the coronavirus task force of the White House. The president departed the podium about 10, 12 minutes ago. A very substantive and wide-ranging briefing there, led by the president and Vice President Mike Pence. I'm joined by a couple of our NBC specialists here right now. I'm going to go to NBC Shannon Pettypiece to ask her, as you are in Washington, what was your main takeaway from this very long and substantive briefing?
Right. Well, I mean, I think the things that people are concerned the most about right now, testing, protective masks for healthcare workers, and the sort of tweets the president has been making about some of the potential drugs and treatments out there. So we got a few updates on those fronts. On the testing front, they said there is now more than 198,000 tests that have been conducted out there. They said there's about 10 million in circulation, but we keep hearing this disconnect between the number of tests available and how many people can get tested. Mm-hmm. They alluded to a bit that some of the labs out there might not necessarily be able to do the testing, so there's a limitation in making sure the labs are getting the type of tests that they need. We pressed the president a lot on masks today, and that still seemed another area of disconnect where the administration is talking about the millions of masks that are in circulation that they have ordered and keep asking where they are. We finally got Dr. Fauci acknowledging that he is hearing the same thing about shortages, but he hopes in days we could actually start seeing the number of masks out there that are needed.
All right, Shannon, thank you for that. You bring up a very good point, though, and I want to further this discussion about masks and the potential of disinfecting them, which is something the president indicated he would be interested in pursuing. Let's bring an NBC medical contributor, Dr. Natalie Azar, on that front. Dr. Azar, as we look at the number of masks, that the numbers were varying a bit in this task force briefing, from tens of millions now to, I believe it was 500 million masks that are needed to effectively combat coronavirus for health workers on the front lines and beyond. The president threw out the prospect of disinfecting masks. He was alluding to the waste, as he sees it, of these disposable masks being thrown away with such frequency. What are your thoughts on the viability of that?
Well, Alex, healthcare institutions are always doing this balancing act between wanting to conserve supplies, at the same time safeguarding their healthcare workers. And CDC.gov has a very extensive section on just this when it comes to the masks, both what's called extended use and limited reuse of the N95 particulate respirators. In addition to that, they always talk about prioritizing the use of the N95s for the personnel that are at the highest risk. The 3M website actually has a section on how you can disinfect. It's using certain bleach solutions and allowing to air dry, but I would encourage, anyone who's doing this. Obviously, if you're doing it within a healthcare system in a hospital, you're going to do or obey the guidance of your administrators on that. But yeah, reuse of masks and extended use of masks is something that is done on a fairly regular basis to conserve the supplies.
Okay, Dr. Natalie Azar, thank you for that. Let's go now to NBC's Kelly O'Donnell, who was in that White House briefing. Kelly, I should note that the president gave you a pat on the back and said you're a very intelligent woman, which we could all have certainly confirmed already for him. But nonetheless, what was your big takeaway?
Well, certainly there was a different mood in the briefing room today, and I also want to say that as the vice president left the room here, he turned to me and said, "Sorry for your loss," in apparent reference to the death of our NBC News colleague, Larry Edgeworth, who passed away after he was tested positive for the coronavirus, a colleague of ours for 25 years, someone I knew personally, as did you, and we have mourned his loss. And so on behalf of NBC and Larry's family, I said thank you to the vice president. So that was a personal recognition of the loss that the NBC family and Larry's family has gone through. On the larger point of the issues of the day, certainly the president was emphasizing again and again that the scale of the response is ramping up and is larger than anyone would have anticipated. He was reluctant to engage on the issues and really put down the questions about the intelligence briefings in January and February and the degree to which the administration should have had more of a sense of preparation. He criticized the Chinese government, saying they had been too secretive, not forthcoming enough. A lot of focus on next steps, like the manufacture of goods that can be put into the marketplace. He still has not used the Defense Production Act power. He is using the sort of specter of it as a way to mobilize manufacturers, but not actually exercising that power while talking about the innovation and the kind of stepping forward that American companies are doing to try to make these things, from masks to gowns to ventilators. So today had a different tone, also talking about some of the technologies where things like ventilators might be able to be used for more than one patient. So we're moving through all of this, trying to gather information and also trying to get specific answers about things promised days ago and where things stand today. On some matters, we were able to get answers. In others, we're still waiting for more.
And we thank you for continuing to ask those questions. NBC's Kelly O'Donnell, much appreciated. And for all of you, you've been watching an NBC News special report, a briefing from the Coronavirus Task Force at the White House. Stay tuned to Nightly News for a wrap-up of this very comprehensive discussion today from the White House. I'm Alex Witt. We now return you to scheduled programming on the NBC network, and we will continue with more live coverage of this breaking news on MSNBC. And for those of you staying with us here on MSNBC, I'm Alex Witt, and we've been watching this coronavirus task force again for the better part of an hour and a half. There were a number of questions, very, very comprehensive. Let's go one last time to NBC's Shannon Pettypiece, who's standing by in Washington. You talked about some of the details. One more reaction from you, Shannon, to what we heard from the Trump administration today. What stands out most to you?
I think we are really starting to see the plans the administration has talked about actually coming to fruition and being put into place. So the distribution of testing, which we have been pushing them on, there does seem to be that coming out. They are, talking about the number of masks that they have, the number of ventilators they have. But of course, the big question right now is whether it's going to be able to keep up with the demand, because as we see these cases just spike and spike and spike, the question I think all along has been, is this administration going to where the puck has been or where the puck is going? Because the numbers are not a reflection of what the current spread and the current situation is out there. So, since the beginning of this, it seemed like an administration was responding to what the numbers were of the day. So 300 cases were responding in that sort of matter, but not seeing what could be ahead of them. And so I think that remains to be seen in the coming days, really, as the testing gets out there and these numbers start to spike, whether those plans about number of masks, number of ventilators, number of tests are going to be enough to keep up with where the demand seems to be going.
All right, NBC's Shannon Pettypiece, thank you so much for that. And for all of you, this is a wrap for me at this hour here. I'm Alex Witt. I look forward to seeing you throughout the day tomorrow, beginning at 7 a.m. Eastern. After a short break, we'll be rejoined by NBC's David Gura. Stay with us, everyone, here on MSNBC.
That'll do us for today here at the Windmill Ministries. Thanking my viewers in regards towards this coronavirus pandemic that has now inundated the vast majority of the world, of those who are in contact with modern day technology and digital satellite form communications. The reality of this is basically a new reality. And the reality is, we believe here at the Windmill Ministries, is a wake-up call for people to get their hearts and their lives right in following after the Lord Jesus Christ of Nazareth. Once more, it speaks very, very definitively and to the point in the first 4 chapters of Revelations to repent, or else I will throw thee off into a sickbed. To repent, that he rather thee either be hot or cold, that if you was lukewarm he would spew thee out of thy mouth. To repent of the sins that you are engaged upon, regardless whether you be engaged upon one thing or another, because one sin is just as bad as the other, according to the Bible, other than the sin of blasphemy. Blasphemy is the unpardonable sin. That's the sin that there is no forgiveness of. That's the sin of people that are being bogus and phony and fake, a bunch of pretenders and actors that's acting like that they're a Christian society, but deep down inside, they're really of the devil. They're not a bit more of the Lord Jesus Christ, no more than a man is on the moon. And I'm just using that for an illustration. But we believe that this is a wake-up call for society of a great revival, of a great revolution that is now looming not only over the American people's heads, but over the whole planet, pertaining to a new system, a new world order, towards getting away from the cash and etc. that is basically nothing more than a germ carrier. There ain't no telling how many people. The other day, I obtained $40 while I was at the pharmacy in Martin, Tennessee. And a young girl that was working at the tellers asked me, said, "How would you like that, sir?" And my first reply was, "Well, give me a 120, a 10, a 5, and 5 ones if you can do it." And then my second reply was, "And most importantly, I want it to be clean." She said, "Sir, I can't promise you that. Dirty money is just one of the most dirtiest objects that mankind has ever touched." And as soon as she handed me the money and I put it in my billfold, they had a big thing of sanitizing, hand sanitizer, right beside the cash register. And before I had time to reach out and get a batch of it to put on my hands so I could rub my hands together, because I just got to touching that money, she had already beat me to the hand sanitizer and was already cleaning her hands just to the pure mere fact of talking about the money. Just talking about the money brought chills to both of us as we was sitting there thinking to ourselves, yeah, that could be the very carrier of the coronavirus. And it could be, because you don't know who was handling that money before you. They could have been sneezing and with snotty nose. They could have been coughing. They could have been, ain't no telling what. Ain't no telling where that money's been. Who's handled that money before you, thousands of other people. God only knows. At the germs that money has carried from one person to another. And don't say that it's impossible, because whenever they say the coronavirus will live on certain objects like wood or plastic for up to days, it's very likely that money could very well be a conduit that can be a carrier from one human being to another. So we think that this is going to open up a brand new venue, a brand new opportunity for our society towards understanding that we're going to have to retrain and regroup and rethink towards what we do and how we do. And a lot of these schools that are being handled right now online, regardless whether it's Skyping or podcasting or whatever, open podcast, live podcasting, these are areas that we're going to have to become readjusted to, just like our traveling from one country to another. We're going to have to reinvent these planes to where these planes are not susceptible in burning crude oil fuel that has been modified over a high octane gas to the point that we're not draining the resources out of the ground and that we're actually environmentally friendly. If we have submarines that can be nuclear energized to the point that they never ever have to be refueled ever again, I personally believe that we can build airplanes that'll do the same. We can build an airplane that will be able to self-sustain itself, and it will never have to have a drop of fuel put back in that airplane. Now, I'm not saying that the airplane won't have to be maintenance. I'm not saying that different components of the airplane won't have to be looked at and oil inserted into various things that work towards holding down friction. We can't completely disembark from the crude oil. We're going to have a certain amount of it, but at the same time, we can limit our need to the crude oil towards hybrid cars, battery powered cars, even inventing natural gas burning automobiles is a lot better than regular gas burning automobiles. Solar panels, using modern day technology in reforming the planet so that these horrible incidences that keep continually occurring in regards to global warming, in regards to an atmospheric warming greenhouse effect, can maybe not be stopped, but it can be reversed or eliminated to some degree. We're going to have to do something to be able to save our planet. And I personally believe that this is a wake-up call of God taking the umbrella of protection away from society. And basically Satan right now is this invisible enemy that is out to kill, steal, and destroy, just like the Bible talks about. And this invisible enemy is purging, tweaking, modifying, separating the wicked from among the just. And it's being done on a level such as we have not experienced here on the planet for the past 100 years. It happened in 1918. It happened in 1918. Matter of fact, it resurfaced and recircled the earth, they claimed, on 3 different times. There's no doubt that whenever God gets ready to do something like this, or allowing for the evil spirit to do something like this, he's doing it for a reason. There is a primary reason in behind the Father, the Creator, allowing for something like this to happen to humanity. And I personally believe that he's allowing it to happen to humanity because we was already a very, very sick nation and a very, very sick planet before the coronavirus had ever emerged into society back in December of 2019. Now, if you'll keep in mind, during the time that we was going through what we was going through here in America pertaining to the impeachment trials, shortly after the trials had ended, in January, after Senate basically gave the president a green light by saying, yeah, he done something wrong in regards to not so much as what he done, but how he went about doing it to the Ukrainians, but it wasn't an impeachable offense. I said right then and there, and I can back it up and prove it on my YouTube channel, that yeah, what you've just done is unleashed and opened up a brand new opportunity for the true justice seeker, which is the creator of this universe, to bring forth the wrath upon to society. And sure enough, within about a week and a half, after those trials had ended, that's whenever we first started becoming aware of the problems that was occurring over in China pertaining to the coronavirus pandemic. It was looked at here in America towards being, oh, that's a their thing. That's a their thing. That won't never happen to us. They're having that problem. They're going to have to deal with that. They're the ones that created it because they obviously done something wrong with the wild animals over in the area where they contain these animals at. I can't believe that today people still eat raw food, not realizing the dangers in eating raw food, regardless whether it's raw chicken, raw bird, raw cat, raw dog, raw cow, raw alligator, raw snake, raw buffalo meat, raw fish. I just can't believe that people is still under that concept of thinking to eat something raw, which basically strikes under the pretense of cannibalism. I still have yet to acknowledge the fact that there's people in the world that still thinks that it's okay and acceptable to eat raw meat. That was the whole primary purpose that they considered pig. They defiled pig at the time in Moses' era, during the time of the Feast of Tabernacles, the Feast of the Unleavened Bread, the Feast of the Trumpets. That's the reason why that they announced that eating pig was in fact an abomination, because pig carries the source of inflammation that can be transferred over into humans more susceptible than any other animal, the ones with a split hoof, based around the fact that they did not properly prepare the pig. Some of them was actually eating raw pig during that time. And they finally figured out, because of various other pandemics, regardless whether it was leprosy or other types of horrible things that started to occurring to society, they finally figured out, by God, this is where it's coming from. It's coming from people eating these pigs. Well, it wasn't just the fact that they was eating pig. They was eating raw pig. Just like they was eating other things raw. A bunch of cannibalism type people during that time. Some people would actually eat other people back then. You got tribes to this day over in other parts of the world, in some of the deep, deep, dark Amazons, some of the deep, deep, dark places where there's tribal people that we to this day still don't know what kind of language that they're speaking. It takes a while for us to get adjusted to their habitat and what type of language that they speak. But we got people to this day that still perform in various places similar towards how they done even before the Great Flood. Barbaric, heathenistic, unusual acting people that are not aware of germs, that are not aware of different things to provide for a safer way of life pertaining to hygiene. You got people to this day that are drinking water that they've used bathroom in. because they don't know no better. They've never been taught any better. People think that everybody is the same here in America, and they're not. You have people all over the world that their digestive system and the way that they think and the way that they process their food and the way that they conduct their lives are totally, totally unorthodox in comparison to the American Western world. Totally unorthodox. That's still to this day in remote areas, just like over in China, eating bats. We know that bats is a coronavirus carrier. And that's exactly what happened, and it did come from China. The thing about it is, it evolved. It escalated. It jumped. When you start having people traveling like they do today on airplanes, it intensifies the problem. It adds insult to misery. Now, does that mean that the coronavirus would have not spread all over the world if we didn't have airplanes? No, that ain't what I'm saying. What I'm saying is it would have still spread all over the world if it was meant to spread all over the world. It would have just done it in a different way. It may have done it through bees. It may have done it through birds. We've got hummingbirds that come all the way from South America up to America during the summer months, and then they'll migrate back. There's all kinds of ways that viruses and germs can be carried, either through birds or through fish or through water, the evaporation of the water being picked up, and then it gets in a cloud, and then it moves 1,000 or 2,000 or 3,000 miles over, and then it dumps that water over into another region. Germs can be carried through that water. It doesn't just have to have human contact of traveling from one human to another. I think that the coronavirus would have still circled the earth. It would have taken longer for it to have merged, but it would have still been just as lethal over here eventually as what it was over in China and what it has been over in other areas of the world. It just so happens in today's modern, fast-paced world, it got over here quicker than what we originally had anticipated. And there's no doubt what Trump done towards stopping the airline industry. He tried to shut the front door and the back door from preventing from it getting over here. But the fact of the matter is, it was still going to get over here. It has to basically go through its process, regardless whether it's here in the Western world or in all other parts of the world. It's got to go through its process, and there'll be some of us that will make it, and some of us that it won't. And they claim that the elderly and the people that's already got pre-existing conditions pertaining to their health can be a big variation of whether or not you're going to catch a bad case of it or just a modern case of it. But the bottom line is this: if it's meant for it to affect you in a way of taking you out of existence, because there is no hope for you to have ever become conformed in becoming a godly person, there's a strong possibility it doesn't matter how strong that your humane system is. It doesn't matter how strong that you are or how young that you are as far as your youth. If it's meant for it to grab a hold of you and turn your world upside down, going back to the old Baptist memento, the hard-shell Baptist memento, which is what is to be will be, and if it's not meant to be, it won't be. If it's not meant for you to carry the virus or be affected by the virus or die by the virus, you won't die by the virus. Now, does that mean that you want to deliberately go out here and become infected by the virus? No. Absolutely not. That would be crazy. That'd be like handling a rattlesnake up in eastern Tennessee, asking for troubles. We're not supposed to tempt the Lord thy God like that. So you use every type of precaution that you can. That's the reason why I stay away from cold reptilians. I don't want them around me. I don't want them in my house. I don't want them in a box. I don't want them in a cage. I don't want a snake, a poisonous snake around me. As a matter of fact, I don't even know if I want an unpoisonous snake around me. Now, some people are attracted to those things. Some people like them. And there's nothing wrong with somebody that likes them. If that's your cup of tea, good. Fine and dandy. You stay on your side of the fence and I'll stay on mine. You play with your snakes and your cold reptilians, your lizards, and any other thing that's cold-blooded, and I'll play with my cats and my dogs over here. That's fine. I don't want you trying to embark upon my rights towards trying to bring a snake over here next to me, and you probably don't want me bringing my cats over to you. So we'll just stay our distances. That's fine. But the point that I'm trying to make pertaining to the coronavirus that did in fact start over in China, if China would have handled things differently, it could have been confined. But because they was devious, deceitful, dishonest, had a sense of non-transparency, not only to their own people, but to the world, now it has grown out of proportion. And now it is spilt milk, and it's something that we're all going to have to deal with it in one form or another. If we don't deal with it directly, we'll have to deal with it in an indirectly way, just like right now towards shutting down the nation to trying to prevent it from having that much more of a profound effect upon the lives of the citizens here in America. That's the bottom line. That's the bottom line. We're going to have to deal with this. It's something that has been brought upon to society, I believe, because of what it talks about in the first 4 chapters of Revelations. And if you don't believe me, read it for yourself. Most people's got a Bible around somewhere where they can pick it up and read it, where it talks about that he will throw thee off into a sick bed. We was already in a sick bed. A great deal of people was already in a sick bed, just like me having being a diabetic. We was already in a sick bed. This is kind of like the cherry on top, the straw that's going to basically break the camel's back pertaining to the sick bed. The sick bed is not only going to be predominant here in the Western world, but the sick bed that's going to basically strike all over the planet. All over the planet. And all you can do is to do like the Bible talks about. Go back. Do thy first works over again. Get your heart and your life right with God. Become re-emerged in the blood of the Lamb and the Holy Spirit towards giving your life back over to Christ if you've fallen from grace. And keep it that way. Stay out of sin. Don't go back into it. Try to live a righteous, holy life. That's what this thing is all about, towards purging, perfecting. That's why we're here, is to not only give reverence to the Creator, but to also give reverence to each other, towards treating each other fairly and proper. And whenever society gets out of proportion, sometimes it takes a balancing, going through some sort of a perfection state. It happened in 1918, and now it's happening now. It's not the first time that these occurrences has happened, and to be quite honest with you, it may not be the last. You deal with it. You deal with it, and hopefully you'll deal with it in the right way. And that's the whole purpose for trying to quarantine people and put them off in isolation to minimize the damage that's going to occur. It has worked in South Korea. It worked. They was gung-ho in what they done towards testing people and quarantining people, and their carnal damage was minimum, a bare minimum, in comparison to Spain, Europe, and other parts of the world right now that are going through severe matters of this coronavirus. That's about all that I have to say to my viewers. This COVID-19. Today is Saturday, March the 21st. Tomorrow is my birthday, March the 22nd. And the reason why that March the 22nd is significant to me, it's not because March the 22nd, 1961, in St. Teresa's Hospital, north of Chicago, give or take about an hour drive, that I come into an existence towards being born into this world. But the reason why that March the 22nd, to me, probably ain't gonna mean a dime to nobody else. March the 22nd in 1988 was whenever I was over at my grandfather's pond that his father helped to build, helped to dig, where I was given my first crown of thorns that started right here. And it went zoop into my skull, zoop into my skull, zoop into my skull, zoop into my skull. It started at one side and it went all the way around to the point of the holy angels, God Almighty, allowed for the very crown of thorns that was placed upon Jesus Christ's head in a supernatural sense was placed upon to my head. And the Bible is very clear in the first 4 chapters of Revelations. See thou that no man take thy crown. We will all be given a crown. And I ain't going to say that it's going to be a crown of thorns, but it will be a crown. Hopefully a glorious crown. Those who are loyal to the Lord and Savior, those who are loyal towards wanting to walk a life of righteousness, that see thou that no man take thy crown, to be faithful even unto death. That the second death pertaining to our physical existence. See, we have a first physical existence upon this planet, and then we'll have another physical existence in the world to come. It says in the Bible that beware of that second death. Well, we don't have to worry about that second death if we've truly been born again in the Lamb's blood, and we have been converted and reformed by the Holy Spirit. Thank you for listening. Good luck to all of us. We here at the Windmill Ministries cannot claim it and name it enough that it's only through and by the blood of the Lord Jesus Christ that any of us can make it into the kingdom of God. Tomorrow will always, on the date of the 22nd of March, be a special, special day for myself. It may not mean nothing else to no one else, but to me, it means a great deal. Thanks again, and shalom. See ya.